live broadcast, we're going to be talking about, actually, we're going to be continue on what we started this morning, and that will be diabetics part 2, continue. Okay, then this morning we talked about diabetes, we talked about causes of diabetes, we also talked about signs and symptoms of diabetes, we also talked about how to manage diabetes. So we'll be dwelling on this for some time now. So in continuation of what we started this morning, we're going to be talking about diabetes, what is diabetes and what causes it. Also going to be talking about some simple home remedy to help alleviate diabetes. So without wasting much of your time, let's get started. And do not forget that whatever we say here does not constitute diagnosis. We are only creating healthcare awareness, and that's all we do. So I will also strongly encourage you to seek medical help. Okay? We encourage you to go for your routine medical checkup. Okay? So this is Gateway 101. Please emphasis on prevention because we strongly believe that prevention is better than cure. Okay? So without wasting much time, let's continue with what we started this morning. We said that diabetes is a long-term chronic condition that affects your body. Okay? It is a long-term care chronic condition that affects how your body controls blood glucose or blood sugar, which is the main source of energy for your cell. Normally, your body uses a hormone called insulin made by the pancreas to move glucose from the blood into cell. So diabetics happen when insulin does not work properly or is not made in enough quantity, so causing blood sugar level to become too high. Let's take that again. We said that diabetes is a long-term chronic condition that affects how your body controls blood glucose, which is the main source of energy for your cell. Normally, your body uses a hormone called insulin made by the pancreas to move glucose from the blood into cell. So diabetes happens when insulin does not work properly or is not made in enough quantity, therefore causing blood sugar level to become too high. Okay? Thank you so much, Ms. Heather. My day was great. Okay? We'll continue with diabetes again this evening. Thanks for asking. Okay, so we're going to be talking about types of diabetes and their causes. Type 1 diabetes. What happens in type 1 diabetics is that the immune system mistakenly attacks the insulin-producing cell in the pancreas. This causes autoimmune reaction. Type 1 diabetes is not caused by lifestyle, unlike type 2 diabetics. So the result will be little or low insulin is produced. So when autoimmune reaction not happen, there will be no insulin or little insulin is produced by the pancreas. So this often started in childhood or young adulthood. If you are type 1 diabetes, you will require insulin therapy throughout your lifespan. Okay? So while type 2 diabetes, which is the most common type of diabetes, what happens is that the body becomes resistant to insulin or the pancreas does not make enough insulin. So see the difference? In type 1, the immune system mistakenly attacks the insulin-producing cell in the pancreas, while in type 2, the body becomes resistant to insulin or the pancreas does not make enough insulin. So, what causes type 2 diabetes is overweight or obesity. Those are contributing factors. Those are factors that can cause type 2 diabetes. Physical inactivity. You don't go to gym, you don't exercise at all. This can also cause diabetes, type 2 diabetes. If you're obese or you're overweight, losing 15 to 20 pounds will go a long way to help. Okay, so overweight can also contribute to type 2 diabetes. So watch your weight and be active in physical activities. Okay, go to gym, do exercise. 30 minutes of exercise 3 times a week is all you need to help you overcome type 2 diabetes. Okay, stay active. Unhealthy diet, which is one of the most common causes of type 2 diabetes. You eating a high sugar food, eating high sugar refined carbs. This can cause diabetes. Okay, this can cause type 2 diabetes. So family history, which is also genetics, can also cause type 2 diabetes. In other words, your great-grandfathers are diabetics, your great-grandfather was a diabetic, your grandfather was a diabetic, parents diabetes, so you have that lineage that comes your root. So from your grandparents to your parents, now you. So be careful if you have a family history of diabetes. So you have to modify your lifestyle. Okay? So aging, also a contributing factor, usually adult, but not now. Increasing seen in younger adult. Type 2 diabetes is not common in younger adult. Normally it's older people that have it, but nowadays type 2 diabetes is becoming common, rampant in younger adult, most likely because of their healthy diet and their lifestyle. Okay? Type 2 diabetes can often be managed with lifestyle changes, oral medication, and sometimes insulin. Okay? We also have another type of diabetes, which is also known as gestational diabetes. Gestational diabetes happens when a high blood sugar develops during pregnancy. That's why it is called gestational diabetes. Pregnancy hormone interfere with insulin function, so therefore causing diabetes. Risk factor: being overweight is a big risk factor for gestational diabetes. Family history of diabetes is also a contributing factor. And previous gestational diabetes, you were diabetes before when you were pregnant. In your previous pregnancy, you were diabetics. And so this can also happen again if you are pregnant again. But usually goes away. It usually goes away after birth, but increases your future risk of type 2 diabetes. So note that. If you have a gestational diabetes, it should go away after delivery, after you have your baby. But it increases the future risk of you being type 2 diabetes. So you have to modify your lifestyle. Lifestyle changes will be a great benefit. You have to be really careful with your diet also if you have a gestational diabetes. Okay? Do not forget, we said that gestational diabetes happen during pregnancy because the pregnancy hormone interfere with the insulin function. But this should go away after childbirth. And it also increases your future risk of being type 2 diabetics. So watch that, okay? Other less common causes of diabetes will be genetic disorder affecting insulin production, disease of the pancreas, so certain medications, e.g., Long-term steroid use, using steroid for so long, can cause type 2 diabetics. Okay, hormonal disorder can also cause, though it is less common, but it can also cause type 2 diabetics. Why is diabetics so serious? If not controlled, if you are diabetes and it is not controlled, diabetes can damage your heart and your blood vessels. It can also damage your kidney if diabetes is not controlled. So it can also cause blindness if diabetes is not controlled. It can also lead to numbness or pain nerves. It can also slow your healing and also cause you a lot of infections. If you have a wound and you are diabetes that is not controlled, that wound will take forever to heal. So what are the common symptoms of diabetes? One, which is the most common symptom of diabetes, would be frequent urination. You urinate a lot. Excessive taste. You drink a lot of fluid, a lot of water, but you still crave for more. You drink a lot of water, you pee a lot, and you are extremely hungry. Extreme hunger. You just ate, after a few minutes, you are craving for food again. These are some common symptoms of diabetics. Unexplained weight loss. You eat, but you're still losing weight. Then fatigue. Become tired and very weak for just doing a minor exercise or doing a minor task. Blurry vision. Your eye become blurry. You can hardly see. Okay, so slow wound healing. If you have diabetes, it takes forever for your wound to heal if the diabetes is not controlled. Okay, so for the sake of you who are just joining us, we're going to recap again. We will recap again for the sake of those who are just joining us. We will recap again. So let's go through what we just said. We said diabetes is a long-term chronic condition that affects how your body controls blood sugar, glucose, which is the main source of energy for your cell. Normally, your body uses a hormone called insulin made by the pancreas to move glucose from the blood into cell. Diabetes happens when insulin does not work properly or is not made in enough quantity, causing blood sugar level to become too high. We also say that we also talk about type of diabetes. I will say that type 1 diabetes, the immune system mistakenly attacks the insulin producing cell in the pancreas, therefore causing autoimmune reaction. We also said that type 1 diabetes is not caused by lifestyle. The result will be little or no insulin is produced, and it is common or often starts in childhood or young adulthood. I also said that if you are type 1 diabetes, you require insulin therapy throughout your lifespan. While type 2 diabetes, which is the most common diabetes, the body becomes resistant to insulin, or the pancreas does not make enough insulin. I would say that the major causes will be overweight or obesity, physical inactivity. You don't exercise, you don't do workout. I will also say that 30 minutes a day for 3 days a week is all you need. Light exercise, and you can also do 150 minutes a week of physical exercise. Also said that another contributing factor to type 2 diabetes will be unhealthy diet, high sugar or refined carbs. We also talk about family history, which is genetics, and aging, usually adult, but now type 2 diabetes is increasingly seen in young adults because of their lifestyle. Can also Type 2 diabetes can often be managed with lifestyle changes, oral medication, or sometimes insulin. Also talk about gestational diabetes. I would say that gestational diabetes is when high blood sugar develops during pregnancy. What happens is that the pregnancy hormone interfere with insulin function, and the risk factor will be being overweight, family history of diabetes, previous gestational diabetes. I will also say that this usually goes away after childbirth, but increases your risk of being type 2 diabetes in the future. Also talk about some other less common causes of diabetes. I would say genetic disorder affecting insulin production, disease of the pancreas, certain medications such as steroid, long-term use of steroid can also causes long-term diabetes. We talk about hormonal disorder that can also cause the type 2 diabetes. Why diabetes is serious? If not controlled, diabetes can damage your heart and blood vessels. Diabetes can damage your kidney, your eye, can cause blindness, levels leading to numbness or pain, feet, slow healing, and infections. Also talk about the common symptom of diabetes. I would say frequent urination is one of the most common symptoms of diabetes. Excessive taste, extreme hunger, unexplained weight loss, fatigue, blurry vision, slow healing wound. Those are some of the common symptoms of diabetes. We also talked about diabetes overview. Okay, we talked about diabetics, what is diabetes and how can it be managed. We said that diabetes is a long-term chronic condition that affects how your body controls blood sugar. Glucose is the main source of energy for your body and comes from the food you eat. A hormone called insulin helps move glucose from the blood into the cell. In diabetics, this process does not work properly. I would say that type of diabetes, we say that type 1 diabetes, the body does not produce insulin. Usually start in childhood or young adult. We'll also talk about people in type 1 diabetes need insulin injection for life. We'll also talk about type 2 diabetes, which is the most common, so that the body does not use insulin properly or does not make enough, often lead to overweight, unhealthy diet, and lack of exercise. Can sometimes be prevented or delayed. Then we'll talk about gestational diabetes. I would say gestational diabetes occurs during pregnancy. Usually goes away after delivery, but increasing the risk of type 2 diabetes later. Then we'll also talk about the common symptom of diabetes. I would say frequent urination, excessive taste, increased hunger, fatigue, tiredness, blurry vision, slow wound healing. Some people, especially type 2 diabetes, may have no symptom at first. How can diabetes be managed? And we say that although diabetes has no permanent cure, it can be effectively managed with proper care. Healthy eating. Eat balanced meal with vegetable, whole grain, lean protein, and healthy fat. Reduce sugar, sugary drink, and refined carbohydrates. Control portion size and eat at regular time. Engage in physical activity. This will help. Okay, physical activity. Aim for at least 30 minutes of exercise, like walking most days. Exercise helps lower blood sugar and improve insulin use. Medication or insulin. Some people need oral medication. Others, especially type 1, need insulin injection. Always take medication as prescribed by your medical doctor. Blood sugar monitoring. Check your blood sugar level regularly. We'll talk about that several times in this program. Okay, when we say that once you are diagnosed of diabetes or pre-diabetes, go and buy the blood glucose machine. It is very, very cheap. It's as cheap as $10 CVS, Walmart, Walgreens, Kroger pharmacies. You buy, the first thing you should buy is a blood glucose monitoring machine, the active checking machine. Once you are diagnosed with pre-diabetes or diabetes, the most crucial thing you should do is to get that machine and make sure you check your blood glucose level regularly to ensure that they stay within a healthy range. Very important if you're a diabetic patient or you are a pre-diabetes. Okay? Losing even a small amount of weight can greatly improve blood sugar control in type 2 diabetics. With management, I will say that losing even a small amount of weight can greatly improve your blood glucose control in type 2 diabetes. So regular medical checkup is strongly encouraged. Eye exam, kidney tests, food care, and blood pressure monitoring help prevent complications. So why is management of diabetes important? Poorly controlled diabetes can lead to serious problems like heart disease and stroke. Poorly controlled diabetes can lead to a serious problem like kidney failure. That's why you see so many people in dialysis today. Okay? We have a lot of people in dialysis today due to kidney failure or end-stage renal disease as a result. So if you don't manage your diabetes properly, you can end up, if you have a kidney issue, you may probably end up in dialysis. So make sure you manage your diabetes properly. Poorly controlled diabetes can lead to a problem like vision loss, lose your vision. Poorly controlled diabetes can also lead to a serious problem like nerve damage. If your diabetes is not properly controlled, your foot ulcer might lead to foot ulcer and amputation. Yeah, because if you have a wound that is not healing, that wound might develop gangrene, then gradually that wound may be amputated. So poorly controlled diabetes can lead to a very serious problem. Okay, let's talk about diabetes management tips. Let's talk about diabetes management tips. Or let us go through this again for the sake of you who are just joining us. Let's go through how to manage diabetes. Okay, let's just go through it again. So although diabetes has no permanent cure, it can be effectively managed with proper care. I will talk about healthy eating. We said eat balanced meal with vegetable, whole grain, lean protein, and healthy fat. Also said that you reduce sugar, sugary drink, and refined carbohydrate. Okay, we also said that to control diabetes, make sure you control portion size and eat at regular time. To better manage your diabetes, we recommend that you engage in regular physical activity. Aim for at least 30 minutes of exercise, like walking most day. Exercise helps lower blood sugar and improve insulin use. Diabetes can also be managed by medication or insulin. Some people need oral medication. Others, especially type 1, need insulin injection. Always take your medication as prescribed by a doctor. And we'll also talk about to manage diabetes, you will need your blood glucose monitoring machine, the AccuCheck machine. Your blood sugar monitoring is key to diabetes management. Checking blood glucose level regularly to ensure they stay within a healthy range. So weight management. Losing even a small amount of weight can greatly improve blood glucose control in type 2 diabetics. So regular medical checkup is extremely important if you are pre-diabetes or you are diabetes. Make sure you do eye exams, kidney tests, food care, and blood pressure monitoring. This helps prevent complications. So I will also talk about why management of diabetes is important, because we say that if diabetes is poorly controlled, can lead to serious problems like your heart disease and stroke. If diabetes control If diabetes is poorly controlled, it can lead to several like kidney failure. So you have a kidney issues, you end up with dialysis. And poorly controlled diabetes can also lead to several like vision loss. You can lose your vision. A poorly controlled diabetes can lead to serious problems like nerve damage. You have numbness in your hand and your feet. You can't feel your hands. You can't feel your feet. And also, poorly controlled diabetes can lead to problems like foot ulcer and amputation. You have a wound that is not healing. This wound might have gangrene, and if care is not taken, that leg or that foot will be amputated. So a poorly controlled diabetes can lead to serious problems like that. So we strongly encourage you to go for your regular checkup. Okay. We also have a simple home remedy to help alleviate diabetes symptoms. So check that out in our YouTube channel and make sure you follow our recommendation, because while this does not constitute proper medical diagnosis or treatment, but if you are having any of these symptoms that I'm mentioning, any of these issues that I'm mentioning, make sure you stay on top of it. Make sure you go and see your healthcare provider, because this is a very, very serious issue. Do not forget, we are saying that if diabetes is poorly controlled, it can lead to heart disease. If diabetes is poorly controlled, it can lead to kidney failure and you may end up in dialysis. If dialysis is poorly controlled, it can lead to a vision loss. You might lose your vision. And if diabetes is poorly controlled, it can lead to liver damage. You can feel your hand, numbness. And also, if diabetes is poorly controlled, it can lead to serious problems like foot ulcer and amputation. Okay, so let's look at some of the diabetes management tips. So let's look at some diabetes management tips. We're saying that here are practical everyday diabetes management tips to help you live a healthy life, more balanced life. This applies to both type 1 and type 2 diabetes with a small adjustment based on your doctor advice. One, we say eat smart, not less. You don't need to starve, you need balance. Okay? So focus on whole grain, brown rice, oatmeal, whole wheat bread, lean protein, fish, chicken, beans, eggs, plenty of vegetables, especially green leaf, healthy fats such as avocado, olive oil, nuts. Then limit your sugary drink and snacks. Stay away from alcohol. Stay away from cigarettes. Stay away from white bread, pastry, and processed food. Large portion of starchy food usually, and stay away from large portion of starchy food, usually rice, yam, pasta. Okay, so make sure you use the plate method. So eat at a regular time. If you are diabetes, skipping meal can cause blood sugar swing. Try to eat meal and snack at the same time daily. Don't skip breakfast. Stay physically active. Exercise helps lower blood sugar naturally. Okay? Aim for 30 minutes of walking, cycling, or swimming most days. Light exercise training 2 to 3 times per week. Even household chores count, especially movement matters, I mean to say. Also that monitor your blood sugar. We cannot overemphasize blood glucose check if you're a diabetes patient. We cannot overemphasize that, because check as recommended by your healthcare provider. Keep a simple log of reading meals, and activity. Learn what food or habit raises your or lower your blood glucose. Okay, so take medication as, as prescribed. Take your insulin or oral medication on time. Never stop or change dose without medical advice. Set your full reminder if needed. Prioritize sleep and manage stress. Aim for 7 to 9 hours of sleep. Practice stress relief techniques, deep breathing, prayer, meditation, or light stretching. Chronic stress can raise blood sugar. Yeah. Stay hydrated, drink plenty of water. Avoid soda, sweet juice, and energy drink. Also, avoid smoking and limit alcohol intake. Smoking increases diabetes complication. Alcohol can cause dangerous blood sugar drop. Drink only if approved by your doctor. Take care of your body. Check your feet daily for cut or sore. Maintain good oral hygiene. Get regular checkup. Get regular checkup. Get regular checkup. We cannot overemphasize that. Check your eyes, check your kidney, and check your blood pressure. Stay consistent, not perfect, but stay consistent. Diabetes management is about daily habit, not perfection. Small, consistent shows need a big health improvement over time. Okay? So, like I said, this does not constitute diagnosis or treatment. All we do in Gateway 101 is to create healthcare awareness, and we strongly encourage you to go to your healthcare provider to be checked so that you can be checked up. So that you can be treated properly. Do not forget, prevention is better than cure. This is Gateway 101. Thank you for watching and stay blessed. Bye for now.